Welcome, everyone, to our segment Care to Share, where every week Jen and I explore crucial skills for healthcare workers. Due to popular demand, we are going to talk about the critical components of harm reduction.
Administrative professionals, this is such an important skill to learn. So, if you're a healthcare professional or just curious about creating safer spaces in general, this is the right topic for you. Leah has done extensive learning on this topic, and there's sure to be something new you and I learned today. Now, let's jump right into it. Harm reduction. What is it?
Yes, Jen, what is it? So, according to the AHS, harm reduction refers to policies, programs, and practices that aim to reduce the adverse health, social, or economic consequences of the use of legal or illegal psychoactive substances without necessarily reducing consumption.
So, from my understanding, it's essentially a more compassionate, patient centered approach that helps us better support individuals who use substances.
Exactly, Jen. I noticed that it goes beyond just providing safe consumption sites. It's more about creating judgment free environments where people feel safe and supported in seeking their care.
I think a big part of that has to do with respecting people's dignity and autonomy. I looked a little into this too, and I noticed it is also about the words we use. I read that stigmatizing language, like calling someone an addict instead of a person who uses drugs, can discourage people from seeking help.
Yeah, not only that, using respectful language can lead to better health outcomes and better trust. But trust also means addressing unconscious bias.
It's so true. Most biases go unnoticed and can affect how care providers treat patients, from pain management to their assumptions about why someone is seeking help. For example, people with chronic pain are often unfairly labeled as drug seeking, and this stigma can leave patients without proper treatment and therefore worsen their quality of life.
Exactly. Another challenge is withdrawal management. If someone stops using substances, their tolerances decreases, which increases their risk of overdose if they relapse. That's why relapse prevention is such an important part of harm reduction.
So, harm reduction isn't just about individual interactions, it's also about tackling systematic barriers.
Yep, you're right. Stigma, lack of training, and inadequate resources can all make it harder for people to get the care they need. That's where trauma enforced care comes in. By recognizing the connection between adverse childhood experiences, substance abuse, and intergenerational trauma, we can offer care that's compassionate and culturally sensitive.
I can understand that. I read that this is especially important for Indigenous communities who often face unique challenges related to racial discrimination and stigma. A culturally sensitive approach is key to building trust and promoting healing.
Yeah, for administrative health professionals like us, we are sometimes the first point of contact. So, understanding harm reduction means treating every patient with respect. When we do that, we create a more inclusive and supportive healthcare environment.
When patients trust us, they're more likely to seek help when they're ready. Harm reduction isn't about enabling substance use, it's about supporting people to make safer choices and live healthier lives.
There is a lot to consider, but I don't feel too overwhelmed. We don't have to do this alone. Educating other healthcare staff, the public, and even collaboration with community agencies is essential for providing patients with a strong support network.
It's one thing we want you to take away from today. It's that harm reduction works. It saves lives, builds trust, and improves public health outcomes.
Beautifully said, Jen. Well, that's all we have for today. Thanks everyone for tuning in. Let's keep learning to care and caring to learn. Until next time.